Okay, everyone, so we're here in our office space surgical suite. We're about to embark in a toe shortening transformation, left and right foot. Let's present the case. This is a patient who is not happy with the appearance of both of his feet. Believes that, as everyone can see here, the second and third toes are almost the same size. So what we're gonna, and he's not happy. He is not happy with how this toe is sitting. It's kind of crooked, so we're gonna go ahead and do this. We're gonna straighten the toe. We're gonna shorten this toe a tiny little bit, and then we're gonna go ahead and start the transformation. The way that we accomplish these transformations, it's a minimally invasive approach. I'm gonna go ahead and hide all the little incisions. You know, there's gonna be one here, one here, one here, one here, and then one here. And then we're gonna go ahead and basically just do what we do. We're gonna basically, you know, the way that I look at this is an art. That's exactly what it is. We're sort of creating a masterpiece from start to finish. So what we're gonna go ahead and do, again, the patient is awake. Patient, are you there?
Yes.
Yes, the patient is awake. This is local anesthesia. That's why everyone sees all these little, a little bit of blood here. This is where we inject. And the patient has walked in, will walk out. And we look forward to this beautiful transformation. So in a little bit, we'll go ahead and we'll put a stop to this, and then we'll reconvene. Okay, everyone. So this is we're here intraoperatively, continuing our transformation. As everyone can see now, there is a little bit of blood. As everyone can see, that's totally normal. We have already shortened number 2, number 3, and number 4. So we've essentially, Elizabeth, can you move the big toe out of the way a little bit? There we go. So it's gonna be kind of like that. That's what we're trying to recreate. The toes are gonna be a little bit smaller, kind of like that, you see? That looks really, really nice. Once we're done here, Caesar will get a shot of the right foot for comparison purposes. But this is what we're trying to do. Recreate the rainbow, recreate the parabola. Once again, using 2 little sutures, right? Caesar, are we able to show that, or is that too? Okay, so let's go ahead. There's one little incision here, right there, and then one back here. 1, 2, and that's it. Boom. And then at the end, we'll go ahead and show the final outcome with the splinting. Okay, stand by. Okay, everyone, so continuation, of course, the right foot, and we're gonna compress everything. Everything's gonna look like this. Bring the big toe down a little bit there, Elizabeth. So that's it. Boom. Absolutely gorgeous. So what we try to do, you see, it's actually shorter than the big toe there. The second toe, third toe, and look at my fingers, Caesar. Kind of like that. See? That's what I'm talking about right there. That parabola. Re-establishing that rainbow. And that's what people are seeking. And again, one little suture there, here, and that's it. You know, I really like to be transparent when we talk about, you know, how we're able to accomplish these outcomes. I don't have a problem showing the world, right? I think it's important. People are always wondering. So, you know, I've always said we're an open book here at Gels Podiatry. So we're gonna, you know, there are no pins, screws, or plates anywhere to be found in any of these feet. Patient is awake. Patient?
Yes.
Right there. And everything, again, local anesthesia, office space surgical suite. We're here just simply listening to some good music. Okay? So we'll put a standby to this, and then we're going to show you guys how we splint everything accordingly. Standby. Okay, everyone, so we're all done. Caesar, come around here. So when we talk about using what we call internal fixation, no pin screws or plates, these pieces of tape that you see here basically hold everything in place. I'm not pushing that on the toes, as everyone can see. I'm just showing you guys basically what we call the reestablishment of the parabola, the rainbow. Second, third, and fourth. Okay, these are the little sutures there in between. We hide everything. And these stay in place for about 4 weeks or so. We change these pieces of tape, these splints, once a week. Okay, but as everyone can see, and again, I'm not pushing down, just kind of going like that so everyone can see the reestablishment of this, right? And the same thing goes for the left here, right? There it is. Tape, and in between here, Caesar. One little suture there, one little suture here. Same thing here. There we go. And It looks really, really great. So we continue to use, and if anyone is wondering, this is the machine that we use, right? People are always asking me, well, how do you see in the foot? And we use something called a fluoroscope, number one. Number two, I see with my hands. It's all basically feel. But we're gonna go ahead and we're gonna now infiltrate a very long-acting local anesthetic. This is something that if I were the patient, I would want this. Basically, we put all the toes to sleep for several days, minimize that discomfort. Surgery is surgery is surgery. One of the things that we want to make sure that we're very mindful, make sure that the patient is very comfortable. So the patient, we're going to go ahead and do this now. The patient will walk, will leave here today, and we'll be back in 2 days here in our office using these ugly shoes that we're going to also fit and provide. This type of surgery is wholeheartedly an art. When we talk about creating a masterpiece, we work and align ourselves with the vision of the patient, which is extremely important. I'd like to ask patient, what are you seeking? What is that vision? Because everyone has that vision of what they would like to see when they look down of their feet, and that's what we try to strive for. I'm not a magician, but I try my best to be able to deliver exactly what the patients are thinking and feeling. So I think this has been a very informative yet educational video. I think it's important for people to understand from A to Z what we do. We remove that element of I wonder, right? That doubt, and that's why I like to really just open up the house, so to speak, here, bring people in here and see what we do. So I'd like to take this opportunity to the patient. Thank you for allowing us to do this. Hopefully it'll help several people out in this world to understand, the toe shortening surgery, toe shortening procedures, the mermaid makeover, and so on and so forth. So as always, thank you for watching.